Respiratory system infections. So the respiratory system is responsible for bringing oxygen into the body, removing carbon dioxide. And so we're all kind of familiar with the respiratory system. It is divided into two parts, the upper respiratory and the lower respiratory. The upper respiratory tract is going to include the mouth, nasal passages, sinuses, pharynx, epiglottis, and then the lower is going to include the larynx, trachea, bronchia, down throughout the lungs and the alveoli. The upper respiratory tract infections include sinusitis, pharyngitis, and epiglottis. And the lower respiratory tract infections include laryngitis, tracheitis, bronchitis, croup, pneumonia. The respiratory tract does have its own normal flora, and the profile of this normal flora is very similar to what is normal for the mouth. That normal flora can vary from individual to individual, just depend on various things like health conditions and lifestyle. First, we're going to look at some of the viral infections that are seen throughout the respiratory system. Most of these viral infections will the symptoms of them will overlap, and severity and prognosis will depend on the particular infectious agent that's causing that infection and the different factors of the patient. Some vaccines are available for most of the viral type infections. The common colds can be caused by rhinovirus or coronavirus. There are some other viruses that do cause colds or cold-like symptoms, but typically we see the rhinovirus or coronavirus as the cause of colds. And of course, you know, colds can be highly infectious. They spread from person to person through respiratory droplets, through like sneezing or coughing, as well as, you know, other contaminated sources that are shared. Of course, symptoms will include things like sore throat, runny nose, coughing, sneezing, body aches, sometimes a very low-grade fever. And usually they're pretty much self-limiting. Only time antibiotics may be needed is if it kind of progresses into some sort of infection due to all those mucus type secretions. RSV we see a lot with children under the age of 5, and it can be a very dangerous viral infection for premature infants or infants in general, or anybody who's immunocompromised, because this infection can actually cause an inflammation within the airways and cause a destruction and damage to the cells, the epithelial cells within that airway. And so with these patients, detection early when it is suspected, this disease is, or this infection is suspected, can usually be done with some sort of antigen type detection. And if the case, you're pretty much going to treat symptoms, but if there is a really severe case, it can be treated with antivirals. Human parainfluenza can cause respiratory infections in children under the age of 5 as well. There are a few different types of this particular infection, but it does have cold-like symptoms in adults, but in severe illness in infants and elderly, you can see things like croup, bronchitis, and pneumonia form, which can cause more severe cases and a risk of death. Adenovirus causes a respiratory type infection that we see a lot of times in children. And so with certain strands of the adenovirus, you can actually start to see complications like conjunctivitis, gastroenteritis, cystitis, bronchitis, pneumonia, croup, and then it can occasionally, depending on how severe it gets, it can lead to a deadly type of infection. And vaccines have been used to try to help prevent some of these infections within the military. Um, but typically, if someone does have this infection, then they're just going to receive supportive therapies. Influenza, we're all familiar with. There are several strands of influenza that are seen. So we do see it throughout the world, and it's passed through respiratory droplets. It is a seasonal type of infection, although we are seeing it throughout the year now, not just in your colder months. And of course, we're all familiar with the symptoms of the flu. Complications that can arise from the flu would include something like pneumonia. And that's usually where you see your problems come in with people dying from symptoms of the flu. It's where the infection actually causes other infections of which the individuals will have complications with. SARS virus, which some of you may remember the outbreak that occurred around 2003. With this particular infection, the disease will start as like a cold-like, flu-like type infection, can present with a high fever, body aches, a cough, and then patients will typically start to develop pneumonia. And so this particular infection can be detected through antigen antibody type testing methods within the lab. There's no cure or treatment for this particular infection. It's basically supportive therapies at the moment. Now we're going to talk about some of the various bacterial infections we see within the respiratory system. With ear infection, this is usually going to be due to usually a secondary response, not always, but it's usually the patient, mostly children, will present with some sort of like cold or flu-like presentation, and because of that increased production in mucus and all of those membranes being inflamed, then you'll actually have that accumulation of mucus that will produce an environment that is very conducive to bacterial growth. And since the middle ear is connected to the pharynx by the eustachian tube, then those tubes can start to become inflamed and they can start being blocked through the mucus buildup, and then that bacteria will start to grow and actually cause that middle ear infection. And so with that, you're usually going to try to treat it early because you want to prevent any sort of damage to that actual the actual eardrum or the ear canal. Strep pyogenes, again, it's been mentioned several times that this is a nasty type of infection. We typically think of it to cause strep throat, but it can also move into other types of infections like scarlet fever or rheumatic fever. So it's very important to be able to detect these infections early. So if there are symptoms of strep throat, then you'd want to go ahead and get that tested and treated to prevent any sort of complications that can arise from that particular infection spreaded due to not being treated. And it can actually go as far to infecting the kidneys, the heart, the bone. It can go anywhere pretty much throughout the body once it hits through that bloodstream or lymphatic system. Diphtheria is caused by Carinobacter diphtheriae. So we see this more often in children under the age of 5, and it's transmitted through respiratory droplets. Although we do have the DTaP vaccine that is used to help prevent this type of infection. With this infection, you have cold-like symptoms, sore throat, low-grade fever. But what you're looking for is that where the pseudomembrane actually forms on the upper airway, and then it can actually cause issues because that pseudomembrane can actually affect the breathing. Whooping cough is caused by Bordetella pertussis. So this is transmitted through respiratory droplets. The DTaP vaccine has been used. And this one has a couple of different phases that it progresses through. With this particular infection, you get that characteristic whoop from that whooping cough where the patient is actually gasping for air. So with this one, of course, you want to definitely be able to be aware of that symptom so that the patient can be treated early. There are a couple of different techniques that are used, mostly PCR testing, to help detect this particular infection. Tuberculosis is caused by Mycobacterium tuberculosis, which is an acid-fast organism. It's highly communicable through respiratory droplets. Of course, we're all probably familiar with TB skin test or being checked by blood test now to see if you have any sort of active or previous exposure to TB. TB itself is characterized by a cough that is blood tinged with fever, night sweats, fatigue, and weight loss. And that is one of the screening questions when they're screening for TB, is they're asking for those particular types of symptoms. Pneumonia is inflammation of the lung tissue, especially the alveoli. And pneumonia can be caused by a variety of things, bacteria, viruses, fungus, protozoa. Even though bacteria and viruses are most common, you can occasionally see fungal and parasitic type infections. So we do look at a couple of different types of pneumonia. We have healthcare acquired pneumonia, in which the patient develops pneumonia after receiving care within some sort of healthcare setting. It could be a nursing home, it could be a hospital. Community acquired, when they're obtained from some outside source, a human or animal, some sort of environmental source outside of a healthcare setting. With typical pneumonia, we talk about it being characterized by signs and symptoms of the consolidation. And so consolidation refers to the apparent merging of the lung air sacs or the alveoli when the fluid will start to accumulate in the lungs. And so this is evident with a white opaque area on an x-ray. And so those are some of the signs and symptoms that they're looking for, some of the different exposures they're looking for when determining what particular type of pneumonia this is. And so here this chart just kind of divides out typical pneumonia versus atypical pneumonia. So you can review through that, look at some of those various signs and symptoms. So typical pneumonia, we're looking at things like pneumococcal pneumoniae, which is caused by strep pneumoniae, or Haemophilus influenza as a cause of pneumonia. And then of course we have our atypical causes, which are going to be either through some sort of animal source or not through an animal source. So a typical pneumonia, again, we're looking at pneumococcal pneumoniae or Haemophilus pneumoniae. And of course, you know, everything's going to be passed through respiratory droplets. And then you're having symptoms like a high fever, the cough, the chest pain, shortness of breath. Sometimes it can be blood tinged, but not always. So once pneumonia is suspected, then the physician may order some sort of like sputum culture, or there's actually some testing that can be done, testing for the antigens off of urine samples. So that's something that's starting now. And there's starting to be some development of looking or testing for these organisms through PCR testing now as well. With atypical pneumonia, you have walking pneumonia caused by Mycoplasma pneumoniae or Chlamydia pneumoniae. And so with these, again, respiratory type infections, you still have some of those same symptoms that may start off like a cold and then just develop to it progresses to causing issues within the lungs. Atypical pneumonia caused by Legionella pneumophila. You see this when the patient is exposed to some sort of contaminated aerosol type water source, so something like an air conditioner unit. A lot of the old cases when this first came out was contaminated air systems that were spreading this particular organism throughout like a hotel. The signs and symptoms would be like high fever, cough, some sort of severe form of pneumonia, or presenting with some sort of severe form of pneumonia. And so it's usually diagnosed looking for the antigen in the urine, and we don't see Legionnaire's disease a lot, but it is a possibility. Psittacosis, we see this due to some sort of animal exposure, usually birds that have this particular organism and transmit it to the individual. Q fever we will see with various livestock and wild animals exposure. And tularemia, again, you can see this with some sort of animal exposure. Usually transmitted some sort of airborne aerosol type exposure, and then symptoms can vary from each disease, but with all of these they can usually be diagnosed either by symptoms or some sort of PCR testing. There are a few fungal infections that we do see with within the respiratory tract. So the endemic infections are usually in a specific geographical location, where ubiquitous type fungal infections, they can be pretty much come from anywhere, but we do most often see these in immunocompromised patients. Sometimes it can just be normal flora that's been kind of gotten out of hand in an immunocompromised patient. Blastomycosis, we see this with blastomyces or paracoccidioides. And so with these particular infections, you can have like a flu-like type of presentation with fever, headache, cough, muscle aches, chills, joint pain. Rarely does this fungus spread throughout the body, but you occasionally can see a disseminated blastomyces where it does spread throughout the body, and once it does that, the prognosis is not very good for those patients. Valley fever caused by coccidioides. This one, of course, is you inhaled the spores and get the infection. Not really any way to prevent it other than prevent somebody from inhaling those spores. So if it is a place that someone may be exposed, then proper ventilation would be key to preventing that infection. Again, flu-like type symptoms. If the infection does kind of progress or disseminate throughout the body, then you can start seeing things like skin lesions or meningitis. Histoplasmosis infections are seen when the patient inhales the spores. They can be exposed, usually chickens, or exposed inside of a cave where those spores are in the dust and soil. And the symptoms will resemble an atypical pneumonia type infection. Occasionally you can see disseminated type infections in which you have infections throughout the body or within the central nervous system. An Aspergillus infection can come through pretty much any source. It's a very common fungus found throughout the world in the soil in various places throughout the natural environment. And so it can be transmitted through inhalation of those spores. So it's most commonly seen in the immunocompromised. The complications could include high mortality rate if this particular infection is not treated early. And so typically culture is how we're going to detect an Aspergillus type infection. Mucormycosis, this is a result of a rhizopus type of infection. And so again, it's transmitted via inhaling those fungal spores. And symptoms are again respiratory type symptoms. There are some immunoassay type of testing that can be used to diagnose this, or they can diagnose just based on examination of like sputum, tissue, or performing various cultures. Pneumocystis pneumoniae. It's kind of unclear how this particular organism is transmitted, but it is thought to be transmitted through an asymptomatic human carrier. And again, it kind of presents with upper respiratory or lower respiratory tract symptoms. If this particular infection is left untreated, it does have about a 40% mortality rate.